My name is Prakash, and I hail from Teluk Intan, a small town in Perak. Having a lot of experience in various industries from financial institutions, manufacturing, retail, and ended up specializing in human resource. I have since retired, and during this retirement period, or even before that, I've indulged myself very much in social work, humanitarian causes. For about 20 years now, I've been involved with Alliance International, doing a lot of social humanitarian projects. And it is something that I enjoy. Cancer is something that I'm quite familiar with. It has run in my family. Many people, family members, have actually gotten cancer before, including my late mother. And I've gone through that situation or experience where I cared for my mother while she was going through treatment and having that ailment, as well as other family members like my aunts, some of my cousins, and so on. So I'm quite familiar with cancer. Yeah, so I have been exposed to some instances where people have recovered, others have had very bad experiences with cancer. And social media at times creates a lot of confusion because sometimes we have a lot of contradictory remarks, examples being given. So in a way, because you go into a situation where it is unknown really, you're still at a loss as to what cancer is all about, what it can do, how one would be able to recover, and the experience of going through cancer in itself. When you're afflicted with cancer, you probably would have gotten some form of symptom that would require certain attention. Now, in my experience, I discovered it quite accidentally. Throughout my life, I've had very regimented bowel movements. Every morning, 6:30, without fail, I'm able to go to the toilet, do my business. But it was sometime August last year where I felt things were not as usual. I used to go to the toilet maybe 3 or 4 times a day, particularly after an hour or so having a meal. And that was a bit of a concern, although it didn't really bother me too much. I attributed it possibly to the food that I had taken, something to that effect. Also, I started to notice that I was losing weight. Again, your mind tends to tell you the so-called causes that it may happen, and I attributed that to the morning walks that I used to take regularly. But the combination of this, the loss of weight, it was not drastic, by the way, but every 2 weeks or so, I typically lose about 1 kg or so, and that was a bit disturbing as well. And then this irregular bowel movements. That got me to think that, perhaps I may need to bring forward my health checkup. I usually was intending to go to have a health checkup at the end of the year, sometime in December. But this prompted me to have it much earlier. So I fixed an appointment with the hospital, went through a thorough health screening, did all the necessary tests, the stress tests, blood tests, and whatever, and waited for the results. When the results came out, together in consultation with the doctor, a lot of it was quite good, I should say, except the doctor mentioned that I had probably had borderline diabetes. Not very high, but still something to be concerned about. And then she asked me another question. She asked me, do you have any other symptom? I thought for a while, and then I said, yeah, I have this bowel irregularities, things like that. At that point of time, I probably attributed it to this newfound diagnosis of having diabetes. But when she put two and two together, she asked me, maybe you may want to go and see a gastro specialist, because there was also an indication of reasonably high cancer marker. But she did mention that even though your cancer marker seemed to be a bit high, that doesn't mean that you have cancer. Nevertheless, with having this kind of symptoms that you've just mentioned, you may want to go and see a gastro specialist. And she arranged it for me. And when I went to see the gastro specialist, he asked me this question: have you ever done a colonoscopy? And that was something that I missed out throughout my years. I never even thought of going through a colonoscopy. And he said, once you reach the age of 45 or 50, you actually need to make sure that you go for a colonoscopy. Anyway, I went through the colonoscopy, and he took out a couple of polyps that were there. And he did mention that he had discovered that there could be a tumor. He proceeded to ask me to go for a CT scan, and the images in itself, from his experience, denotes that, it possibly is cancer. But he did mention, I'll send the sample over for biopsy. Let's wait for the biopsy report. And when the biopsy report came out, he said, yes, you seem to have a tumor there, and you probably need to go deeper to examination and see a colon surgeon, a colorectal surgeon. I approached a colorectal surgeon, and he did an MRI, and it confirmed that I had stage 3A rectal cancer with a tumor of a size of about 7 cm. After my diagnosis with the colorectal surgeon, he mentioned that I should go and meet an oncologist. Because one of the key things that he mentioned was to be able to shrink the existing tumor so that he would be able to perform the surgery in a more manageable manner. And the reason why that was is because the tumor was located very low, at the very low area of my rectum, just about 2 cm above my anus. It's a bit of a tricky surgery to go through. So he arranged for me to see an oncologist, and it is through the oncologist that they decided to have me go through a neoadjuvant treatment, which means going through a combination of radiotherapy and chemotherapy before the surgery in itself, with the hope that the tumor will shrink. So I was prepared for that, although, there's a lot of horror stories that you hear that if one goes through chemotherapy, you'll have all sorts of side effects. But I was prepared for it. And the oncologist said, looking at your history, your blood test results, and so on, I would take you through maybe 25 fractions of radiotherapy with 5 sessions of chemotherapy, IV, and let's hope that it works, because based on his experience, he felt that that would be the best form of treatment for me. And so I proceeded to go for the treatment that was recommended by the oncologist, with all the arrangements being made. And it was, I should say, fairly aggressive treatment, because from Mondays to Fridays, I would go for the radiotherapy session. And on Fridays, in the mornings, I will go for my chemotherapy with about 4 to 5 hours session. And in the afternoon, continue with my radiotherapy. Although the radiotherapy session was about 15 minutes long, but still the preparation for radiotherapy is quite tricky, in the sense that, before you get into the chamber, you need to be able to consume enough water to fill your bladder, and to the extent that it is at the time where you have the urge to urinate, that indicates that your bladder is full, and you go through the radiotherapy chamber. And of course, the nurses and the radiotherapists there will tell you whether you have an optimum level to go through the process. If it is too much of water retained in your bladder, you have to let it out. If it's too little, you have to consume additional water to go through. So I had certain challenges in that sense. Sometimes it goes very smoothly. At other times, I have to release a bit of urine, or other times I have to drink a bit of water. So that was the radiotherapy session, but it was not painful at all. When I go through the 25 fractions of radiotherapy and the 5 sessions of chemotherapy, I didn't really have very severe side effects, except for one time where after my 3rd chemo, I had bladder retention, in the sense that after going back home after my chemo session, about 2 or 3 days later, I found it very difficult to urinate. And there was an urge, but what comes out are just tiny drops, 1-2 drops, and it's acutely pain. Same thing with, when I want to pass motion, I had the same problem. And I couldn't really bear the pain after some time, and went into emergency, got myself warded, and the nurses fixed a catheter. They gave me an IV laxative, and that helped. And for consecutively 2 days, the urine was drained, and I had 10 liters of urine that came out from my bladder. The following days, it reduced slightly. That was an experience, really. which sort of attributed to the treatment I've been going through. You do develop certain side effects after going through the treatment. Like, for example, I developed an allergy to fish and seafood after some time, after treatment, where I get hives and rashes. Then through my oral chemo that I'm currently taking, I do have certain pigmentation. My palms blackened somewhat. And all these things do affect you, although it's physical in nature, but you can sense the changes that happen in your body. The neoadjuvant treatment worked for me in the sense that after going through the radiotherapy and the chemotherapy sessions, my tumor actually shrunk from 7 cm to 2.5 cm. And that prompted my colorectal surgeon to move me quickly into surgery. I went through surgery and he took out my tumor together with my rectum. So now I live without a rectum, and while waiting for the area where my big colon, the intestine, is attached to my anus, while that area is healing, I have now an ileostomy bag. And which is something that I need to live on temporarily before a reversal surgery is done. So what this means is that whatever I consume, it goes through the digestive process, but it comes out through my stoma, which is the small intestine attached inside out and attached to the bag. So I'm living without a rectum, having a ileostomy bag, and that also has got certain challenges, I should say, because with the bag in itself, you need to drain and clean out the bag. For me, every 3 hours or so. And that is something that obviously I'll be able to do myself. However, there's also a need for me to change the base plate that I have, for which the ostomy bag is attached to. And that I would need to depend on my wife. She had gone for training from the hospital on how to manage the ostomy bag and changing of the base plate. And it requires some form of technicality, really. You know, you have a stoma, and the process is you need to have a plastic covering to draw the outline of the stoma, cut the base plate so that the size fits the stoma. It cannot be too big, nor can it be too small. It just needs to be the right size. And you have to care for the wound that may occur around the stoma. And while you are doing it, you can't stop the output from coming out. It's like a lava spurting out from a volcano. So much so, it will take 45 minutes to 1 hour just to change the base plate. So that's a challenge. And and you have to adapt to it. There's also this fear that, what if there's a leakage? What if your stomach bag falls out? And it has happened quite a number of times to me. So while you are recovering from the surgery, in this sense, there are also challenges that one needs to cope with. And as I mentioned earlier, you also have got all different types of side effects coming into play at different times. I'm now on oral chemotherapy, taking tablets internally. And a time will come where I would need to go through a reversal surgery, as I mentioned. At that point of time, my small intestine would be attached back to the big intestine, and I should go through the normal process of digesting food. But I still need to be able to adapt to a new way of life because I do not have a rectum. So whatever I consume would ultimately come out quicker than a normal person. But I have the assurance from the colorectal surgeon that, the body is a fantastic thing in the sense that it would be able to adapt itself over time. Maybe it'll take me about a year, where I would then be able to have a trigger that allows me to differentiate between output of feces and flatulence. And until my next surgery, I would probably need to live with diapers and adapt. And over time, I hope to be able to live a normal life. Well, not to say normal, but an adaptive life. There are times where this ugly head of doubt and negativity comes out. And it's quite peculiar in the sense that it develops and comes out at a time where everything is quiet at night, just before going into bed, just before you get into deep sleep. There's a certain period where you start having thoughts coming to you. This question of why me? In my interactions with a lot of cancer patients, this is something that some cancer patients actually ask, And it's quite ironic in a sense that some of my friends even ask me this question. You have been with the NGO, with Alliance International, and I still remember one of my signature projects that I was very active in was dealing with childhood cancer. You are now afflicted with the very ailment that you seem to be familiar and being of service to. So why me? But as I mentioned before, it was something that I had accepted. And I told myself, maybe God wanted me to experience being a cancer patient so that over time, once I've recovered, I would actually know what goes through a cancer patient's mind, heart, and I would be possibly of better service to them and their families and caregivers. So that's what went through me, really. The key thing to me is really to accept the disease that you have, the ailment that has afflicted you, because it is there. To accept the fact, and this is for me, one of the biggest reasons as to why I have this new perspective of life, is accept the fact that perhaps even after recovery, there could be an instance where it recurs, and be prepared for it. Accept the fact that perhaps your lifespan may be shorter, because it's the fact that your body goes through certain changes, whether it's through the medication, the treatment, or the ailment in itself. I can see changes taking place in the physical sense. But mentally, when you are strong, when you accept this fact, I think it gives you a new sense, perspective of life. You appreciate life more. Prayer definitely helps. And, of course, during the time where you pray, you ask the Almighty for you to be able to recover fast. But then again, you see, I'm one person who does not really ask for blessings or for recovery, because I feel that when you pray every day for the well-being, and it is not just because you have a crisis that you seek help from the Almighty. So in a sense that while prayer helps, a lot of it really depends on yourself. Because I always believe that God will help those who help themselves. And that has been the way my spirituality being has come about over the years. Of course, I have also been very fortunate to know that a lot of people, family, friends, pray for me diligently, even until today, for my recovery. And for that, I am quite blessed. So in going through this journey, I have always been confident that through this spiritual advantage, so to speak, that I have, will take me through this journey unscathed and recover eventually. To me, one of the biggest things that has helped me in my recovery process is really the mindset. Being positive, although it's difficult, but accepting the fact that you have got this ailment, accepting the fact that things are not going to be the same, accepting the fact that there are changes in your body and ultimately your lifestyle, accepting the fact that you have the Almighty who would see you through this journey. I appreciate the people around me that have helped me in this journey. Of course, my wife, my family members, my friends. It is a combination of all these things that I think has helped me go through this journey with a positive mindset and to fight this through. So acceptance is really important, having faith, overcoming the challenges that you will face, and I faced quite a number, going through the motions, educating yourself with knowledge, and share the experiences, talk to people, don't keep things within you. It has sort of helped me in my journey because I do write about my experience in my Facebook, share the stories. And it is an outlet for me to talk about myself, an outlet for me to be occupied, to be active, and not just brood over the ailment and challenges that I'm facing. The journey that you are going through because you're getting educated and learning a lot more, having knowledge over time. So there's a lot to be grateful for too. Although you have got a challenge to undertake. And you see yourself growing in that sense. And that is a huge positive and a takeaway for me. Sharing the joy of being able to overcome this journey, the small wins that you have. I have now gotten a new lease of life, looking at things differently, appreciating a lot more because you only have one life.